Pharmacology, the cardiovascular system. Antiarrythmics. Class 1 is sodium channel blockers. Class 1 antidysarrhythmic medications slow conduction and prolong depolarization by decreasing sodium influx into cardiac cells. There are 3 groups of sodium channel blockers: Class 1A, Class 1B, and Class 1C. Quinidine is an example of a Class 1A antidysarrhythmic. Lidocaine is an example of a Class 1B medication that is also used as a local anesthetic. Flecainide is an example of a Class 1C antidysarrhythmic. The mechanism of action. Quinidine slows conduction and prolongs depolarization by decreasing sodium influx into cardiac cells. The conduction rate and automaticity are decreased. This medication also has alpha antagonistic properties that cause peripheral vasodilation. This medication is typically used for life-threatening ventricular dysarrhythmias, such as ventricular tachycardia, or for conversion of atrial fibrillation that has not responded to other therapy. Sodium channel blockers are contraindicated in patients who have a history of thrombocytopenia or myasthenia gravis. Use cautiously with patients who have serious heart block rhythm and do not have an artificial pacemaker, such as a second-degree heart block. There is an increased risk for toxicity with patients who have heart failure and renal or hepatic dysfunction due to drug accumulation. This medication's safety has not been thoroughly evaluated in children and geriatric patients. Grapefruit juice should be avoided by patients taking this medication. Quinidine may prolong QT interval, leading to ventricular arrhythmias, such as ventricular tachycardia or torsatus dispointes. Quinidine may induce thrombocytopenia. Routine lab work may be evaluated by a patient's healthcare provider. Common side effects of this medication are nausea, vomiting, diarrhea, fever, chills, abnormal ECG, arrhythmias, and headache. In many research trials, use of antiarrhythmic therapy for non-life-threatening arrhythmias actually resulted in increased risk of death compared to placebo. Patients should be instructed regarding the significance of compliance with therapeutic drug regimen and take medications as prescribed, even if not symptomatic. Patients or family members may need instruction on how to take pulse rate and parameters regarding reporting to their healthcare provider. Some antiarrhythmic medications may cause dizziness and may increase sensitivity to light. Medication grids are intended to assist to learn key points about each medication class. Basic information related to a common generic medication in this class is outlined, including administration considerations, therapeutic effects and side effects, adverse effects. The prototype or generic medication listed is the medication grid is also hyperlinked to free resources. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. So the quinidine medication grid, antiarrhythmic class 1, monitor blood pressure, heart rate, and QT with administration. avoid grapefruit juice, maintain consistent sodium intake. Healthcare providers should review medications as this medication may interact with many medications. Controls supraventricular arrhythmias, may lengthen the QT interval, arrhythmias, dizziness, and headache. May cause thrombocytopenia and GI nausea, diarrhea, and vomiting. Class 2 medications, Class 2 beta blockers. Class 2 medications are beta blockers that are used to decrease conduction velocity, automaticity, and the refractory period of the cardiac conduction cycle. Sotolol is a beta 1 and beta 2 blocker that also has class 3 antiarrhythmic properties. Recall that other types of beta blockers, such as metoprolol, are also used to treat hypertension. The mechanism of action. Sotolol is a non-selective beta adrenergic blocker that prolongs the cardiac action potential. Indications for use. Sotolol is given to patients for life-threatening arrhythmias such as ventricular arrhythmias or supraventricular arrhythmias. It is not recommended for patients with less than severe arrhythmias. Titration of this medication is done by evaluating renal function and monitoring QTc on the ECG 2 to 4 hours after each medication upon initiation. Patients with decreased renal function require dosage adjustment. Sotolol is contraindicated for patients with decreased serum potassium, bradycardia, second or third degree heart block, heart failure, and conditions leading to bronchospasm. Some adverse or side effects. This drug can cause arrhythmias. This medication lengthens a patient's QTc interval. Initiation of this medication requires a patient to be in a facility to determine baseline QT and intermittent QT interval checks. QT interval checks are done 2 to 4 hours after each dose. If the QT corrected interval is greater than 500 milliseconds, the dosing must be changed. Common side effects for Sotolol are arrhythmias, chest pain, palpitations, fatigue, dizziness, hypotension, bradycardia, heart failure, cardiac ischemia, bronchospasm, thyroid abnormalities, and hypoglycemia. Patient teaching and education. Patients should be instructed regarding the significance of compliance with therapeutic drug regimen and take medications as prescribed even if not symptomatic. Patients or family members may need instruction on how to take pulse rate and blood pressure. They should receive parameters regarding reporting to their healthcare provider. They should report any pulse rate that is low and significant changes in blood pressure. Patients should also be advised that these medications may cause dizziness and visual changes. Patients may also notice orthostatic blood pressure decrease with position changes and should be advised to change positions slowly. If the patient notices irregular fast heart rate or experiences any fainting episodes, they should notify their healthcare provider immediately. Additionally, these medications may also mask the signs of hypoglycemia, so diabetic patients must use extra caution to monitor for low blood sugar. They may also increase cold sensitivity. Class 3 potassium channel blockers. Class 3 medications prolong repolarization by blocking the potassium channels in cardiac cells that are responsible for repolarization.